Out of 100. That's how many people in the world end up getting schizophrenia. Now, 1 out of 100 might not seem like that big of a number, but it does add up. Schizophrenia is a problem in today's society because it does not have a cure yet. They've only come up with different treatments for it. I've done research online, research papers, and I've actually met schizophrenic patients. So every time I learn about this disorder, more facts are coming up, and scientists and whoever else is looking at this disorder, they learn more and more each time. First off, before we get in depth, it's probably a good idea to know some of the basic facts about schizophrenia, such as, what is schizophrenia? Schizophrenia is basically described as a psychotic disorder, a false perception of reality, and a social disorder. A false perception of reality basically just means that everything is altered by the voices in the person's head that has schizophrenia. So they'll hear voices throughout the day, and they see things differently than the way we do because they have a voice inside their head that's telling them that things are different, and they cannot separate the voice from reality. So they believe in the voice and not what's going on around them. Some of the symptoms of schizophrenia are hallucinations, delusions, violent or aggressive behavior, and disorganized speech and behavior. Hallucinations and delusions are hearing voices in your head that aren't real. And schizophrenics also oftenly feel wind that isn't real, and they see non-existent things. Violent or disorganized behavior comes from the voices in their head once again. They believe that everyone and everything is out to get them. So, for example, if they're watching the news, it'll be like the newscaster just telling them that the weather is out to get them, and the weather is coming to look for them. So, as you can see, it'd probably get very scary, and it puts them on edge often. And disorganized speech and behavior just comes from what they hear. It makes sense to them, but it won't make sense to any of us. If you ever talk to someone who's schizophrenic, you often can't really understand what they're saying because it seems as if there's no train of thought. You might be asking yourself, how can I become schizophrenic? Well, genetics, environmental factors, abnormal brain structure, and brain chemical imbalances are all leading contributors to schizophrenia. Genetics is 10% compared to 1%. 1% of the general population in the world gets schizophrenia, but 10% of people that have parents or siblings that have previously gotten schizophrenia are more likely to get it. By, I believe it's 60%. Now, they don't know the actual deciding factor of what schizophrenia is caused by. So you have to remember that genetics only influence your chances of getting schizophrenia. They don't actually determine it. Some of the environmental factors are low oxygen levels, abuse in childhood, virus, and early parental problems. Low oxygen levels are during a young age of birth, and most of these are during childhood stages. Abuse in childhood, this can be physically, mentally, or sexually abused as a child. Virus by being sick at a young age. And early parental problems such as divorce or abandonment by parents, once again, at a young age. Abnormal brain structure has been low activity in the frontal lobe, which is related to planning, reasoning, and decision making. And this has only been observed in patients that have schizophrenia compared to just your regular healthy person. Brain chemical imbalances. There's dopamine and glutamate, and this has been noticed in patients as well. Dopamine is essential for function of nervous system, nerve impulses, and mood regulation. And glutamate is normally involved with learning and memory, and it can lead to depression if imbalanced. So these would just be higher levels or lower levels compared to just people like you and I, which makes them act different than us. And is there a cure? There's no cure yet, but they have come up with treatments such as psychotherapy, antipsychotics, and antidepressants. Psychotherapy is just one-on-one counseling where they try and work through your problem. Antipsychotics are just a medication you can take along with antidepressants. And schizophrenia is a fascinating disorder that deserves more attention, and I believe it should be educated more to people like us. So hopefully we can find a cure. And it's estimated that by 2050 we'll continue with disease, and we'll be able to find the cure. And I just hope you can recognize and understand schizophrenia better, so you know exactly what it means to be that 1 out of 100.